Good afternoon to one and all. I am Dr. Avani, consultant reproductive medicine, Apollo Fertility, Kondapur, Hyderabad. Hope everyone is doing good. So today I'm here to just tell you about a basic topic like when a couple should visit a fertility clinic, what is fertility, when you should seek help from doctors, all the basic things. So now coming to fertility part, what is fertility? Fertility is able to conceive with a viable egg and a sperm, and when you should visit. So now we are planning to conceive. So what next? So first thing what you have to do is you have to see a doctor, and they would take a detailed history of you, like any medical problems previously, or you have undergone any surgeries previously, or any are you on any current medication for any kind of issue. And when you're planning conception, you need to take the preconceptional vaccines, such as rubella, get tested. And when you are planning conception, women should normally check their hemoglobin, thyroid, sugars, basic blood workup should be done, so that further when the conception is there or when you're pregnant, there are no further complications involved with the undiagnosed problems, such as when you hypothyroid or when you're anemic, or diabetes went unnoticed. And we if the woman is overweight, it is always better to lose weight before planning or conceiving, as they might cause complications during pregnancy. And if you have a habit of alcohol or smoking, or more usage of caffeine in coffee, it is always, the studies and all have shown that alcohol and smoking will affect the pregnancy. And they alcohol during pregnancy also, we have seen that there are intellectual disability and behavioral issue with the children who are born. And you need not stop completely taking coffee, but definitely you have to limit the usage of coffee. So all these things have to be done. And another thing which is very important and should be followed is eat a balanced diet, maintain an ideal weight, maintain an ideal weight. And in the diet, it's always better to stop outside foods, artificial sweeteners, or preserved food, limit the dose, or limit the usage of caffeine. And Your plate should be filled with all colors of food, such as greens, fruits, leafy vegetables, and healthy foods which are available according to your taste. Then when you are planning for the pregnancy, you need to take prenatal vitamins such as folic acid and other vitamins. And as I have told previously, maintaining an ideal weight is good, and also exercise is a must in your routine, where you need to do exercise for 30 to 45 minutes. It can be walking, yoga, or swimming, or aerobics, or whatever you are used to. And last but not the least, when you're planning the conception or pregnancy, we have to be emotionally strong. So you need to reduce your anxiety and stress. Whatever reduces your anxiety or stress, such as um, uh, yoga or meditation or listening to music, or if you're interested in dance, lots, or if you're interested in whichever reduces your stress. And at least 6 to 8 hours of sleep is a must, so that it will reduce your anxiety. Now coming to, this is the fertility part and what do you expect. And now Now, what is infertility? Infertility is defined as failure to achieve pregnancy in 12 months of unprotected sexual activity. So this so now when to seek help? So now, if you're less than 35 years, you have to try for 1 year with unprotected intercourse, and you can visit the fertility clinic. Or if you're above 35 years, you need to try for 6 months, and if it is still you're not successful, then you need to visit the fertility clinic. Now, when you come to the fertility clinic, what do you expect? So, in the fertility clinic, we so when you come to the fertility clinic, the doctor will examine you. We would take a detailed history of you, both of you, regarding your regarding your any previous diseases or any surgeries, or are you allergic, or any family history of any medical issues. If you have any if you're already having any medical problems such as hypertension or diabetes or thyroid, we would like to check whether it is under control, and we would suggest alternative medications which are safe during pregnancy. And as I previously mentioned, routine blood workup, like such as your hemoglobin, sugars, thyroid, everything would be checked. And in the male, we would want to check the sperm factor also, which is done with a simple test called as semen analysis, where we would know the concentration, motility, and the morphology of the sperm, which three factors are very important in conception. Now, coming to the female part, the investigations would be done when you come to a clinic. A basic ultrasound, that is an ultrasonography, would be done for the pelvis, where we would assess the uh, ovaries, uterus, and in a female, the reproductive system consists of uterus, two fallopian tubes, and two ovaries. So, in the ultrasound, we would check the uterus whether it is good, or any other pathologies seen, such as fibroids, or any endometriosis is there, adenomyosis is there, or any polyps are there. How is basically the uterus? And any congenital factors can be ruled out in a 3D pelvic scan, such as so that the cavity and the uterus should be fine. As if the pregnancy has to come and stick or implant in the uterus, we need to check. Mostly, we would know in the in the scan any if any issue or problem is there with the uterus. This we can find out in the basic ultrasound. And next, we would assess the ovaries. In in women, as at birth we have certain number of eggs, which is known as our ovarian reserve. And as our age increases, the number of eggs come down. And after the age of 34, along with the number, the quality also comes down. So what we have seen in the studies and all is, at before 34 years, if the abnormal embryos percentage is 15%, after 34 we have a 30% chance of abnormal embryos, and after 40 years we have a chance of 50%, because it all depends on the number and the quality of the egg. Now, after we have assessed the ovaries and the uterus in the scan, we have regular fertility hormones which would be done. That is AMH, would tell us the ovarian reserve, the prolactin hormone, the thyroid hormone would be done, and the fallopian tubes would be assessed if required with various methods such as HSG or saline sonography accordingly. And then now coming to different causes which cause the infertility, or difficult in conception. So now coming to the female part, as I previously mentioned, the reproductive system of the female consists of uterus, ovaries, and tubes. So we have to assess any difficulty. If we see a woman having regular cycles, generally the period when they start the cycle or the bleeding starts, it is the day one. And we have seen is in the normal physiology, the dominant follicle or the ovulation happens in the middle of the cycle between day 11 to day 18 of the cycle. And this has to be checked first in the ultrasound, where naturally whether the woman is ovulating or anything, that would be done. And later, what we have seen is difficulty in ovulation is seen where we have hormonal imbalance such as PCOD, where ovulation may not happen naturally, and any kind of polyps or any uh, uh, fibroids, polyps, or any endometriosis is there, or in the SSG or SSG, we have seen there is a block in the fallopian tubes. All these factors may lead to infertility, and each couple, according to their age, married life, as well as their since when they are trying and how much treatment has been done prior, depending upon the cause of the infertility or the subfertility, we would start the medication or the treatments. So now coming to the sperm factor, as egg is important, sperm is equally important, and nowadays we have seen a few percentage of increase in the male fertility factor. And as I mentioned, this semen analysis is a simple test, and after it is done, we mainly see the three factors such as concentration or the motility and the morphology. So, as and when, depending upon the WHO standards, we compare it and we start antioxidants and medications. If the concentration is too low, we would suggest less than 5 million or 5 to 10 million, as and 10 to 15 million. So depending upon the age of the couple, the married life, and since how many years they have been trying and the previous treatment, the treatment would be suggested. And after the investigation, so now there are three modes of treatment when you come to a fertility clinic. That is uh, timed intercourse, intrauterine insemination, and uh, in vitro fertilization techniques. So you are young, married for like 2 years, you've been trying since 1 year, not happening, and all the tests look fine. We would start with a basic treatment such as ovulation reduction and timed intercourse. Then, like if few couples, timed intercourse is like during the ovulation time, we would suggest to we would tell the patients and they would try normally. And now next treatment is the intrauterine insemination, where the sperm sample is processed and all the good sperms are separated and placed inside the uterus. And the last and the most advanced treatment is the artificial reproductive techniques, where we use in vitro fertilization plus or in vitro fertilization plus ICSI, where the fertilization which normally happens in the fallopian tubes, it is done outside in the lab, and the embryo which is formed, which is placed inside the uterus. So I just want to give a brief outline on the IVF procedure. It is a simple procedure. I won't say that it is absolutely, like, there are a lot of misconceptions about IVF, that it is very painful, where it is not painful, and a lot of other misconceptions are like you need complete bed rest when you're in IVF treatment. It is not at all the case. Only when we are when we are doing the procedure of oocyte retrieval, only on that day the anesthesia would be given, and that too it is a daycare procedure, and you can always go back the same day. And for the embryo transfer, we do not do it under anesthesia. It is a very simple procedure. And yes, after we have transferred the embryos, you have little more medications, but uh, it is not at all painful, or you need complete bed rest, or you would be admitted in the hospital. Nothing. This treatment, you would not see all those things. And another common question which I get is, what are how the babies would be of IVF babies would be when compared to the normal babies. Are there any abnormalities or any developmental delays in the IVF babies? Now, IVF started almost 43 years ago, and lot of literature studies have been done, uh, seeing the IVF babies' growth and their development. In the studies and the literature, what have found that there is no much difference between the normal conception and the IVF conception babies. So there is nothing to worry or panic. As And the one more question, what we generally see is, when what are the complications? Is it like we have more complications with IVF babies or IVF pregnancies? So here I just want to mention that when in a pregnancy, there is a chance of 15% of risks. What are the risks? The risks are either miscarriages in the first trimester, or the ectopic pregnancies. Ectopic pregnancy means the pregnancies in the tube, or uh, anomalies which were detected in the fifth month scan, or other complications like growth restriction and all these complications are about 15% we see in the general population, which is the same in IVF pregnancies also. So uh, all these are myths. I can say that it is more painful, the babies are abnormal, and IVF is very stressful, and you have to be bedridden for many days. All these things are misconceptions about IVF. So, the take home message is, please, first is health is very important. You need to maintain an ideal body weight, ideal BMI, with a balanced healthy diet, and have a stress free life, and plan your conception after checking that your health is all right, all the blood reports are normal. In case you find any thyroid issues or BP or sugar, first and foremost you need to visit the doctor. Just tell them that you're planning conception, take a correct medication which is safer in pregnancy, and just plan your conception. And if you are not conceiving, even after that, is if you're below 35 years and you're not conceiving even after 1 year of unprotected intercourse, please visit the clinic immediately to just check whether everything is all right. If is all right, nothing to panic. And if you're above 35 years, within 6 months you need to visit the clinic. As why I'm mentioning the ages, as our age increases, I have mentioned that the ovarian aging is there, and there is a decrease in the number as well as the quality of the eggs, so which would cause an abnormal pregnancies, and which was cause an abnormal pregnancies or difficulty in conception if there are less number of eggs in your body. So there is nothing to worry regarding IVF treatments, because it is the most advanced treatment which is available now for the couples who have been trying since long to conceive, and there is every chance of having a good, viable, healthy pregnancy, and which would go to have a healthy child, and make your dream come true of having a child. So thank you so much for patient hearing. We are